In regards to substance abuse and addiction, I do not see any benefits of zero tolerance, especially with our children.
That was my guest this week, Dr. Stephanie Rose, who's an assistant professor at the University of Central Arkansas and is extremely educated and passionate about addiction and how it's addressed. Hello, I'm your host, Martin John, the Recovery Mentor. You're listening to the Recover Yourself podcast, and we address all sorts of topics you'll face while on a journey to recovering yourself. This podcast and all of my work is produced to support caregivers of all kinds, while also expanding how we understand both addiction and recovery. I'm interested in doing this because caregivers are so often overlooked, and when they have problems, we all have problems. Today, Stephanie and I are looking at zero tolerance and stigma. When we're born into communities that support zero tolerance, we can easily create a black and white worldview. Once that sort of thing has been created, it's hard to tear ourselves away from it. And if and when we find ourselves at odds with those ideas, we will see ourselves as bad, when in reality, it was the law that's been bad this whole time. And the worst thing about it is that we know the law's bad, but we continue to back it. Stephanie, thank you so much for joining me.
Thank you for having me.
I am looking forward to this. We are talking zero tolerance. Let me just start. What is the history of zero tolerance in the States?
So when we look at the history of zero tolerance, I think it can go back much further, when we look at unofficial policies, historically. However, zero tolerance really started during the Nixon administration. And that was kind of, a platform.
Ironic.
Yeah, part of his platform, right, to run for president. And then it became much more prominent during the Reagan administration. And we had, don't do drugs, right?
Just say no.
Just say no. And so we started to see a lot more people being incarcerated, especially minority people. During the Reagan administration, we had the crack epidemic, which unfortunately affected a lot of minority populations, poor neighborhoods. And so we started seeing these increases in people being incarcerated for nonviolent offenses. And then we move into the Clinton administration, who, implemented gun-free school zones and started adding additions to these zero tolerance policies. It gets concerning because zero tolerance, you think these are teens, their brains are underdeveloped, right?
Right.
That whole prefrontal cortex, that's not even completely developed, but, that's where you make your rational decisions. That's your impulse control. And for us to take such a hard stance and expel a child, even if it's a first offense for a substance related offense, is not even developmentally appropriate. It's referred to as the school to prison pipeline, because once they're expelled, they are much less likely to ever finish high school or gain employment, and they end up in the DYS system a lot of times, and then into the adult prison population.
So zero tolerance has been around for a while, and we've been dealing with it, and we've learned a lot. We've learned a lot about how it doesn't work. So what are the benefits of having zero tolerance?
In regards to substance abuse and addiction, I do not see any benefits of zero tolerance, especially with our children. A lot of people don't know that a large percentage of these youth get put into adult facilities where, talk about being exposed even more to trauma and abuse, and they're much more likely to become victims of sexual abuse as well. And so when we look at that trauma lens, these complex trauma, experiencing trauma over and over and over again, that's what we're doing to these people. And then we expect them to, and looking at what the Reagan administration did, once people are released from prison, they don't have a lot of options. Many of them do not have a GED even. We ban them from different work sites. They're there's so many limitations once they get out, yet we expect them to not reoffend and back up in the system. And so, the system is certainly flawed.
Yeah, I mean, when we get a for-profit system and they end up back in the system, maybe we don't expect them to not go back in.
And Arkansas, for a few years, no longer did for-profit prisons. However, that is the talk is that is making a comeback, unfortunately.
Oh, that's very unfortunate. And congratulations for at least not having one for a little while, because that's dirty.
Yeah. And our youth, our DYS, has been operated by a private system for years. Despite, as I said, a lot of kids reporting abuse in those facilities.
Yeah. Right. If a pregnant woman finds herself in need of help because she has an addiction, what are her options, and how great are those options, seeing as you are a zero tolerance state?
Well, once it gets reported, they immediately go into the system and are assigned, a social worker who investigates and then starts referring programs. The unfortunate part is that we do not have a lot of programs that are specifically for this, because there are a lot of, we're going back to stigma, a lot of doctors that are like, I'm not touching, I'm not prescribing methadone, Suboxone, anything like that to a pregnant woman. Like, I don't want that liability. It could also be based on personal beliefs. UAMS is one, I don't know if you're familiar, University of Arkansas Medical Sciences. It's a teaching hospital.
Okay.
They have done a lot of work. We have, I think, 39 delivering hospitals in Arkansas. Many of them lack resources on how to handle like preterm births. And if a mother comes in and has been using, what do we do? And so UAMS has even developed this 24/7 hotline where doctors can call for guidance. And so UAMS has a program specifically for pregnant women using, where they can come and get, they prefer to use Suboxone, but there's also a separate clinic if the mother was previously on medication-assisted therapy, where she can go and get methadone. But the preference is Suboxone. And there is a clinic in Northwest Arkansas that offers it. However, that's about it on resources.
Mm-hmm.
So, you have that. And then sometimes they don't get options to do that. You're going to detox. And then we go into neonatal abstinence syndrome, which increases so many dangerous risks for these fetuses, these infants.
Like, zero tolerance is an idea that is not coming from a place of saying we are with you if you have an addiction. Correct. It is definitely here to build an other. This is for the neighbor of the person who has an addiction problem. And this is preying on the fear of those people, these fear tactics. And that is building this kind of cultural stigma. Can you speak to this series of unfortunate events?
Well, so, you mentioned scare tactics, and I wanted to touch on this. I can't tell you how many clients have come to me, and I'm the only person that they have ever confided in that they're struggling with a substance abuse problem or with anxiety and depression even. We haven't even moved past the stigma of mental health. And, I think we forget, we look at certain people, especially people from backgrounds of poverty, we dehumanize people when they become addicts. We take that out. Like, you are not worthy of, can you imagine a mother being told that she's not going to be able to be in the room with her baby, who's in the NICU, or be able to visit. and just how helpless that must feel, and how, you know, not feeling supported through that. And we know, that's just feeling guilt and shame. And what does guilt and shame lead to? Relapses. It leads to using more. Mothers actually who are treated punitively by the law, their suicidality increases, as does overdoses. So we can see where it's not doing any favors in that regard. And with scare tactics, we forget that there are a lot of functioning addicts out there. I treat a lot of them. They want things to be very, they don't want to lose and damage their careers. A lot of it is alcohol use and opioid use. And I think that says a lot too, that, because of these punitive processes, people, that are going into work every day hungover, and in some cases still, maybe have some
intoxicated.
Yeah. They're going to work and they're afraid to ask for help because of these scare tactics. Wow, talk about a domino effect. If you have a care provider or someone in power that is struggling and they can't get the help that they need, and they are treating all these other individuals. And I wouldn't be a good social worker or citizen if I didn't bring race into this a little bit. If you take a look at the crack epidemic and how, and I have stats on that as well, of how disproportionately, brown people were locked up versus white people. No one was saying anything, right? No one was really getting involved. Lock them up, and now we look at the opioid epidemic and how differently that was treated. And what are some of the factors that play into that, perhaps?
Suburban white.
Suburban white, exactly. And then we have this odd social acceptance of alcohol use. Yet it is, usually besides tobacco, one of the number one substances that teens are going to abuse. It's related to the number one cause of MPAs amongst teenagers, and it's the third leading preventable cause of death in the United States. But there's not a lot of stigma attached to that because it's more socially acceptable, and it's, some of our elite people, have wine and cheese soiree. I just think of all these things.
Yeah.
After I had my baby, who was born premature, and that's what got me very passionate about this. She was in the NICU for 2.5 months, and I was one of those parents that was up there every chance they'd let me. But I think I was the only parent visiting, because the other parents, and being in the field that I am, when I overhear things, I can connect the dots, weren't allowed to be up there to visit those babies. And I just thought, that's affecting their brain development, their attachment style, all of these things that are going to affect them down the road, and are also correlated with substance abuse and trauma.
I see zero tolerance as being so much for this idea of the perfect citizen, right? Like, we want to build this for the people that have jobs and pay taxes and do all these things. And there is this made up idea that people who use drugs don't do those things. When I see people in recovery, they are so passionate about what they do and who they are. And it doesn't ever look like within a zero tolerance environment, help is really the best option, because it is mandated that you tattle. I don't know why anybody that was pregnant would put themselves at risk to talk to their social worker at all.
Or a doctor.
Yeah.
And the doctors, when you go for your appointments, are going to test you. They're going to drug test you every time.
That's how they do it. So if you go to the doctor, you get a drug test automatically?
They screen you, yes.
Regularly throughout your pregnancy? Man, that seems very invasive. Is that invasive? Maybe they
You
do
know,
it in every state. I don't know.
I think being pregnant and going to those appointments is invasive in general.
I would
Um,
imagine.
but they're more likely to get reported by the doctor, the OBGYN, than they would be like a therapist or a social worker, because that's who
Mm-hmm.
they're going to see first most of the time. But I
Mm,
think it says a lot that the women who choose, who live in states that have non-punitive laws actually have better rates of women coming in for treatment and better outcomes. Fewer, babies die, fewer mothers die because of this.
and this is about, to some degree, really about education, because we educated people for years that your neighbor could be using the drugs. Right? Like your neighbor is an addict, and now you're in danger. And that's not that those two things don't equate.
I think a lot of the stigma too is because you abuse substances, you're also violent and dangerous. And I think we need to get away from that too,
Yeah,
because many times that is not the case.
right.
But it's part of the stigma.
Yeah, it's part of the story that we were told so we can get behind zero tolerance.
Look at how the media covered, for instance, the crack epidemic. They were showing people, being violent and in different areas where there was so much poverty, and the police were, really trying to go in there and crack down. And we had riots and,
That was
but then it was covered so differently with the opioid epidemic. We saw like empathy coming out of this, right? And, and it's like, what is the difference here?
Now you do training and you do other things like that. Are the other social workers on board with you, or is this something that you have to help train them into backing?
Social workers, for the most part, it's part of our ethics to advocate for these types of policies, treatment versus incarceration. It's been a little more difficult with the, criminal justice field because, we all have our roles and we've all been taught differently. I have been pleased. I've been contacted by some police officers asking for resource lists to give to people so that, if they show up on scene and someone's, maybe been battered by their husband or is using and wants treatment, they can take them.
Mm-hmm.
And so that is encouraging to me, and I would like to continue that path. But, I just think it depends on the profession. A lot of the trainings that I was invited to do during the past summer was, please help us inform these healthcare providers on how to treat people with trauma and substance abuse, because they walk into the ER and if they're under the influence and they've been assaulted, for instance, they're not treated. I mean, it already is a difficult process.
Right.
But they're especially not treated well if they come in under the influence. It's already that dehumanization again.
Zero tolerance creates an environment where we are where we're dehumanizing our neighbor, for lack of a better word, I suppose. I mean, I think that's a perfect word, but
And it's socially accepted. It's part of it's part of our law.
yeah.
And I think people go with the status quo, and sometimes that's difficult to overcome.
What can we, as people who advocate for those who have substance use disorders, those who have mental health disorders, do to influence people who don't, to not demonize? Because it's real easy, and we see it in politicians all the time. They'll demonize until their son comes up either gay or an addict or whatever, and it's like all of a sudden they're like, why or how can we show people that, like, no, we're dealing with people here, not monsters?
So I think that, community events that create awareness, making we did great putting all these billboards up. Just say no, dare to say no. So
A lot of money in that, though.
why can't we put some of those funds into, hey, if you're not alone, or messages like that imply, um, to people that we're targeting, but also stakeholders in the community that care about their community. And I think, the more messaging is very important, how we message these things. And like you mentioned earlier, like the media, oh, your neighbor, your grandchildren could, and in some cases that's true, right? We need to educate people that their medicine cabinets can very well be, a means for especially youth to get a hold of substances. I think that's important, but without using that scare tactic. Like, okay, so if this were to happen, what resources are available for you to get this person help? And I really, honestly, I'm not a fan of using the term addict, labeling someone as an addict. To me, that is the same as saying, oh, the schizophrenic, or oh, the OCD person. That's not who they are. It's just a part of what they're struggling with. So once again, we go back to that dehumanizing message. And I think we need to work on our messaging. We need to involve social workers, professionals in the community that help treat substance abuse issues, and better educate our policymakers who make these laws. And never underestimate the power of, Twitter and sending messages and writing letters. And something I'm really proud to be involved with is this network we have in our state called the Arkansas Collegiate Network. And what we do is work together with various campuses throughout our state. And we have events called Save Our Students, where we talk about, all kinds of topics related to substance abuse on college campuses. We brought Narcan onto campus. We're trying to get it trained into other campuses that have residential living. And then we march the Capitol. They see people, the more people they see showing up, the better. And so I think I think for a long time, many of us have been inactive activists, and, we feel and we know what we need to do, but actually putting that into play is where we fall short sometimes.
When I was younger, I realized that I had some zero tolerance within me, even though I, am coming from a background of, having addictive tendencies and overuse disorder, or whatever, however we want to kind of discern it. And, someone reminded me, and there's a meme out there now, and this was mentioned to me probably 10 years ago or something, where it was like, if you're saying that it's all right to, beat a kid because they turned out okay, because I turned out okay, well, then you didn't actually turn out okay. So this is and that was something that played with me, where it was like, yeah, okay, I got beat as a kid and I turned out fine. And it's like, okay, now you can beat a kid. That is a bit of a zero tolerance sort of thing in my mind, where, well, if A plus B equals C, right? Like, and then that's fine. And we can put people in jail because they can get out of it, or whatever, like, because I did, like, I said no, so you should be able to, and all of these ideas, and the ideas that are behind, like, zero tolerance, and how deeply woven it is into our culture right now. I mean, you mentioned that, I'm sure it started before, but it started with Nixon, and then, perpetuated even further by Reagan and his wife. These things really are so buried into the depths of our culture that we are unable to see it. I mean, yes, we can go to the law books and say, yes, okay, well, there is an actual zero tolerance thing. But your mind, everybody in this country probably has things that they are okay being zero tolerance about. And yet, zero tolerance is a thing that is just closing us into a box and probably hurting us from seeing opportunities outside of that.
Well, what we're doing is the system just seems to keep coming full circle. And despite that, we continue to do the same things over and over again.
And we're just coming out of this pandemic, and one of the biggest things everyone is talking about is the economy. And fine, you know, we're the United States, we have to talk about the economy, and we're trying to get kids back into school, and we're trying to get all of these things back to normal. And the thing is normal wasn't working, and if we don't recognize that it wasn't working, if we don't recognize that things like zero tolerance wasn't working in a school, then we're going to go back to a time when only a select few people were being serviced anyway. And what we're trying to do now is going back to the same select few people that were being serviced before. And there are people that are thriving right now with the way that things are. And we're trying to dismantle that because those aren't the people that were being serviced in the past. And this has happened over decades with zero tolerance, where we've serviced certain industries and we want to continue servicing those industries and continue servicing those the things that benefit from zero tolerance, because our neighborhoods aren't getting enough benefit out of this. Our country and the state, in terms of the number of people that can utilize these services that aren't being able to access them because of things like zero tolerance, we are missing out on thousands, if not tens of thousands of people all the time because we're shuffling them into a system that brings very little to light.
And I think privatizing prisons, how is that ever a good idea?
No,
for the vulnerable population? We put people who are vulnerable into these situations, and they're making money off every bed they keep filled, and so we have to look at that. And as a community, I think it's important to also, with messaging, when you are supporting policies that can help people to improve, you are supporting policies that are going to also improve your community
and your economy.
And then the economy. And, you brought up, we talk about, sure, prisons are profitable, but they also cost the state a lot of money. And if I think if you look at that, and even, mothers who struggle with substance abuse, that costs the state a lot of money. When those babies are, forced to go through, neonatal abstinence syndrome and maybe go to foster care before they get, connection with their mother and whatever the hoops the mother has to jump through, they end up with more hospital visits and, more complications. And then we see behavioral issues down the line. Like a lot of people don't know fetal alcohol syndrome, spectrum disorder. When I say that, what do you think of? A lot of people automatically think, oh, they're going to have the close eyes and, kind of the thinner upper lip and things. The majority of kids with that do not actually have the physical characteristics, and they end up getting misdiagnosed down the road with things like ADHD, and disruptive behavioral disorders, conduct disorders, when it's fetal alcohol syndrome. And, and so, we have this also kind of culture. It's kind of talking out of both sides right? When we're
These are some of the
saying,
problems that we
oh,
deal with.
this drug, zero tolerance, alcohol. You know how many women when I was pregnant told me, oh, it's okay to drink a few glasses of wine a night to relax? There is no evidence that supports that any amount of alcohol is safe during pregnancy. And it all depends on, the mother's metabolism, the fetus's metabolism, genetics. And I think that's the other thing with messaging. We have to get away from it's a choice. We have to look at it's related to family dynamics. It's related to histories of being abused. It's related to, we know that if kids are exposed early on to even nicotine, they are like 3 to 4 times more likely to pick up that habit themselves. And then the genetic component. We know that a brain from someone who struggled with alcoholism looks much different than a brain without that. We can look at brain scans and see differences. And until we're able to look at this as a medical issue and the brain in general, with mental health, it's, we're going to have to get over that hurdle and see it from a different.
And like you say, it is like talking out of both sides, because if you're saying, well, don't drink any alcohol, like that's zero tolerance, right? Like when we're saying don't use any drugs when you're pregnant, that's zero tolerance. And the thing is like we have to trust people are going to do the right thing. And when we have compassion and when we can love each other from where they are and be like, yeah, okay, I'm 6 months pregnant, I've been drinking for the last 4, like that's what we deal with then. We don't backtrack and say, okay, now we're going to put you in prison, we're going to make it worse, and we're going to do like how silly is that?
Yeah, we're going to lock you up, and pregnancy is already such a time where a woman feels so vulnerable as it is, because there's so many things out of your control. And can you imagine being in an institution of some sort?
And that baby is developing, receiving all of that stress hormone that the mother is producing.
Oh, absolutely.
It is gaining information.
I have a list of things that happen from neonatal abstinence syndrome, and they're not good things,
Right, yeah.
So we're really doing more damage than we are good.
And we're sending that into the future. Like we are creating a future adult with stress that is all built around a law that we know doesn't work.
Especially for non-violent offenders. And, we already have such a high population of people with mental illness who are incarcerated. I mean, people with psychotic disorders incarcerated.
Yeah.
And, I think that as well is, not helping. We need specialized facilities back that can actually help these people and actually provide some rehabilitation.
One of the things that, this kind of gets off topic, but we totally got rid of the flop house. And it's really, the flop house was a place where, you could go if you had like addiction problems and if you had mental health issues and stuff. And they had people and because they were all in one place, we were able to kind of keep tabs on them. And we had social workers that would go there and they would be able to deal with things. And then, getting rid of that sort of a service. And I understand it's for profit, no doubt, but like it was really built for people who were coming back from war and dealing with PTSD and dealing with things that were difficult and we didn't know how else to deal with. Well, when we got rid of that, we just started putting everybody in prison. And we created these zero tolerance sort of laws that, say, well, if you can't, pay $1,500 a month for rent, we don't want you on the street. And this is, greedy 80s. This is where that built. Please.
We do things like look at Skid Row in LA. We're going to put you all in, this area and not let you leave. And it's the Wild West. We also see how that doesn't work. But there are some really cool, I'm very into harm reduction methods. And
Mhm.
so I think like clean needle clinics are great.
Drug
You
testing
know,
facilities, so you can find out if what you have is like filled with things that you don't want to be taking, so you can kind of find the cleanliness of the drugs that you're taking.
there's a really good website called, I think it's called Dance Safe, and it has all the trends. So it's for people that go out to parties and go to raves and different things like that.
Hmm.
And it tells them kind of, hey, alert, this particular strain of this substance has been laced. We've seen a lot of, it's laced with PCP or whatever.
Right.
And then it has like safety guidelines. If you use this drug and start to experience these symptoms, here's what you need to do.
Yeah.
Um, the needle clinics are great because when we can get people to come in, we can say, hey, if you ever want treatment, we're here for you. We can help you.
Right.
And also give them condoms, other,
Yeah.
other safety things. I believe in San Francisco, they have started an initiative, and they're called wet houses. Are you familiar with those?
Nope.
So have you been to San Francisco?
Yes.
Lots of homelessness, right? And so, they were seeing a lot of these older gentlemen being murdered, just dead on the street, being thrown in dumpsters. And so they created something called wet houses, and they're monitored by, kind of like someone who would be in let me find my words.
I don't know what you're gonna say.
A halfway house. I'm sorry.
Oh, okay, yeah.
Um, and they are doled out alcohol. Like you get one beer, X amount of, every so hours. And so a lot of people were against this. Oh, it's enabling. It's this, it's that. These people are functioning better.
Oh, yeah.
They're living. It's more humane.
Yeah.
Some of them are on the end stage, liver disease or cirrhosis, but they're dying with dignity. They're
Yeah.
not dying on the street.
Well, fuck, they're living with dignity.
Yeah,
Like,
yeah.
and that's the point. Like, why do we want to tell, like, this idea that anybody wants to tell somebody that they shouldn't be getting a beer every 2 hours because of their situation is just mean. Like, why do you have, like, what is the skin that you have in that game that you need to stop somebody from living with any dignity at all? You would rather them be on the street and be murdered or be abused or be kicked by somebody because they have no value in our society. Like, that's not what we're about.
The funny thing is, I worked in a hospital for about, 5.5 years as a patient care tech when I started nursing school, but then switched to social work. And the doctors would even order X amount of wine or beer to patients who were in there for like heart issues or different things, so that to prevent them from going through that withdrawal. Because
Yeah.
the two substances that withdrawal can be very fatal, alcohol and benzos, that was being done already in the medical field.
Yeah.
And, but people are like, and then they say, well, I don't want my money spent on these things.
Yes, you
When you
do.
looked at what was spent on the wet houses versus, the multiple
Mhm.
ambulance visits and
That's right.
hospital admissions of these
No,
people,
yeah.
you're paying for it through your
Yeah.
taxes or
Yeah.
or through hospital
And
price increases.
you are going to save so much money if you just treat people with motherfucking dignity. Because then they'll have a reason. When they're mad, when they don't know, like, when they're not getting respect, they're not going to find that they have respect for themselves. But when you say, hey, look, we get it, go on. And then they're going to be like, you know what, maybe I can do better. Because they have a reason to. Because there's some love in their life, for Christ's sake. Like, so many.
Recognizing that it's a process. We want it to look like this.
Yeah.
Straight up, right?
Fuck.
But it looks like this. and people get frustrated.
If we're lucky,
you
it looks
know?
like that.
Right? And I always tell my clients, I'm like, there's a strong chance that you may have a relapse, and it's okay. I'm still here for you. I'm not going to judge you. Just keep coming back and we'll talk it out.
Yeah.
And I think like that, saying that to them, and I learned to say that a long time ago, because all that guilt and shame related around use, that embarrassment, and just, it's hard. And to have somebody say, I'm here for you unconditionally, is so powerful. And in some cases it's taken a year, some cases it's taken 2 years, but these people eventually get there, and it's very cool to see them reach their journey.
It's interesting. I don't work really closely with people that have huge issues. Like my whole my clientele, the people that I work with, are people that are beyond the idea of recovering from, because my whole thing is recovering to, and it's this thing. But I do talk with IOP programs. So I go in and I'll do a talk on IOP. One of the first things I say is, I don't care about your sobriety. Like, I don't care if you go out and use at all. And if you do, that's on you. Go do it. But like, I'm still here. I'm still going to talk to you. I don't care if you use or not. You need to do that, because I can't control what you're going to do or not. But I love you. And that's the thing. I love you, and I'm not going to put myself in danger for you, right? You have to love yourself, and you have to care about your sobriety, and you have to do all those things. And that's one of the first things I say to the group before I start going into the thing that I do. And it's real important, and they all love it, because it's oftentimes like those people are so skeptical that anybody cares. So skeptical, because they have been under the cost so much that nobody cares about me. And when I come in and I say, look, I love you, I don't care about this, they can really kind of glom onto that and be like, that's right, you shouldn't care about it. Why would you care about it? I know how to manipulate people that care about my sobriety.
Yes, yeah. I was going to say, the beauty of that is you're letting them know they're unconditionally cared about, but you're also setting that boundary that you're not going to be an enabler.
Right. And I'm gonna be here. I'm gonna talk to you. I'm gonna shoot you straight, and we're gonna like each other. And that's how it goes. That is the
best approach. I always tell my clients, look, I'm a really blunt person, and so me sugarcoating things or not talking to you about this directly is not going to do any good. I've never had a bad reaction from that. People like that.
People love it. They want. Yeah. These people are straight shooters, man. Like they know when they're being bullshit.
Absolutely. And so if we could just change that stigma that we have and work on that as a community. And if you look, and this is social work perspective, person in the environment, it's never just one thing affecting this. We could just do a diagram, put the person in the center, and all these factors around them, right, that are just piling on this person. Yeah. And they're using dysfunctional coping skills, because sometimes, especially with youth, that's all they know to use.
That's right.
That's all they've been taught to use.
And that's what they're going to use as adults if they don't get taught anything else.
Exactly. Yep.
Stephanie, thank you so much for talking so much with me about this.
Well, as I said, I could talk about this kind of stuff all day long. This is something I'm very passionate about. So
you can find links to more of Stephanie's work and background in the description of this episode. Zero tolerance is something we have to address, not only in the law, but in our lives. How many ideas do you hold on to that are all or nothing? To examine this within ourselves is a great exercise in recovery, because intrinsically we don't really want to prevent anyone from being themselves. And I say that because presumably we don't want to be prevented from being ourselves. That's why we decided to get a recovery program. You see, addiction is all or nothing. When we were out there, I bet most of us had some kind of a zero tolerance policy, asking others why they didn't drink or use, questioning them often because they made us feel uncomfortable, and that just wasn't okay. Luckily, today we, the lucky ones, can see these things from a different angle and accept that there are people out there who are struggling with themselves the way we were. Unfortunately, they just can't see it right now. There was a time that was true for us, and just because we used drugs and alcohol doesn't mean that other people aren't using money, education, or power in their place. Please rate and review this podcast and/or leave comments for this episode to help me better create helpful content. Support this show at anchor.fm or support me and my work at Patreon, where you will get access to unedited content as well as writings and access to supporter group portrait sessions. I host workshops regularly, which are both open to the public and are a source of continuing education units for professionals. I also take a limited number of one-on-one clients every month, so contact me through martinjohn.com when you are ready to work together. I accept financial support through Venmo at martinjohn_Garcia. So if you benefit from listening to this content, please consider supporting my efforts. Thank you for listening to the Recover Yourself podcast, and until next time, keep recovering yourself.